Hi, my name is Shanti. I will be briefly discussing with you guys about marriage and family therapy. I chose marriage and family therapy because growing up, I witnessed my mom and dad always fighting, always arguing, and I never knew why they didn't seek help. I feel as if they seeked help, maybe they would have never got a divorce. Okay. So I'm sitting here with Miss Amanda Nicholson. She is a licensed marriage family therapist. She attended Savannah State University where she got her bachelor's degree in behavior analyst. Okay. Then after that, she decided to go to Mercer University where she got her master's degree in marriage family therapy. Okay, so now she's currently working for a company called Joy Us Beginnings. Okay, and she will be briefly giving you guys a brief overview of the things she do in her life as a marriage family therapist.
Okay. Hello. My name is Amanda Nicholson. I am a marriage and family therapist here in the Atlanta, Georgia area. And basically affect them that are part of their familial patterns. So we look at transgenerational trauma. We look at patterns that are passed down from generation to generation that are affecting the individual or the family as a whole. This could be people's mental disorders, communication patterns, or different things of that sort. So I work with full families as well as just couples, and sometimes I work with individuals as well. So being a marriage and family therapist, the modality that I come from is that I use a lot of mindfulness in therapy. I also come from a narrative standpoint. I believe that client stories are for them to tell and for them to figure out. Narrative therapy basically involves making a story out of what happened to that family or that individual or that couple that's coming in for therapy. And it basically involves taking the problem away from that person. So instead of saying that person is angry, it's kind of like, well, what has anger caused you to do? And that's the kind of stance that I take. As a therapist, many therapists use other stances, so that could be solution focused, Bowenian therapy. Bowen is actually one of my favorite too because he does a lot of family work and generational work. We also have emotionally focused therapy that we use a lot with couples. We have solution focused therapy, which is actually a really brief fast therapy that happens. Another one that is very well known is called Gottman. So Gottman, him and his wife, they actually work with couples. They're very world renowned marriage and family therapists. So there are a lot of different perspectives that we come from when it deals with dealing with family and couples issues and even individual issues, because people come in with individual issues about their family. So marriage and family therapy is important because we focus on the system, so the family system. So what working with the family system shows us is how patterns are passed down from generation to generation. And so we also look at how the problem within the family unit or the identified problem is affecting everybody in the entire family. So for example, say if we have an IP, but the IP is the identified patient, that's the child, and the child has been acting up in class. What we would do is we would look at the family system, and so we would look at the parents. So how are the parents acting at home? Are they having trouble? And is little Johnny acting out because of what he's seeing at home? So we come from a systemic standpoint. And when we talk about the system, we see the family as a system and sometimes as a contribution to the identified problem. So I went to Mercer University. So the qualifications for becoming a marriage and family therapist involved a master's degree in marriage and family therapy, or you can get a general psychology or clinical degree, and you can take the licensing exam after you have obtained a master's degree. So during many master's programs, that involves you doing a practicum for a year before you are allowed to apply and sit for the licensing exam. After you sit for the licensing exam, you have to do another 2 years of experience where you have to gain 2,000 hours hours, depending on if you're doing full-time or part-time work, as well as an additional 100 hours of supervision. So say if you go to a school that has a marriage and family therapy program and you decide to be a marriage and family therapist, what happens is while you're in your program, you get 100 hours of supervision from an AAMFT supervisor. So when you graduate, after you sit for the exam, if you've already an AAMFT approved program, basically all you need is 100 hours of additional supervision from anybody. But say if you decide later that you do want to be an MFT, but you have a general psychology degree or a clinical psych degree, you have to get 200 hours of supervision, and 100 have to be from an AAMFT approved supervisor, and your other 100 can be from a LPC, LCSW, or a psychologist, but it has to be supervised post graduate work that has to be paid as well. So when it comes to salary, so the salary can range depending on what type of work that you want to do. So a lot of MFTs, they do at-home therapy, they go into private practice and different things like that. So I can guess around your salary can range from about $30,000 a year to probably $100,000 or more, depending on if you work for somebody or if you're in private practice, as well as other work that you do. So speaking engagements, if you write books, if you teach, and those different things also factor into the salary of people who are therapists as well.
Thanks, Ms. Nicholson. That was great. Okay, and I'm glad you was able to give us a little bit more insight. Hearing it from a real licensed marriage family therapist, it really has me thinking like, do I want to really do marriage and family therapy? And I think with my personality and the way I'm able to listen to others and able to give feedback, I can do that type of work, because I'm always willing to do things that's going to help others and things that's going to, whatever advice I can give someone. But on the other hand, salary ranges, we'll see about that. I feel if I was to be able to become a marriage family therapy, I probably would do other things on the side. I would have to open up practices, visit people's homes, things like that. So I really enjoyed this interview with Miss Nicholson, and thank you again and you guys for your time.